My name is Holly Chapman, co-founder of Community Overdose Response and Recovery Effort, or CORRE, and I'm here to talk to you today about harm reduction. So the fentanyl overdose crisis continues to ravage communities across the United States, especially in Texas. Between August 2022 and 2023, Texas saw an estimated 5,000 drug-related deaths, with fentanyl involved in about 45% of these cases, according to the CDC. In 2023, fentanyl was linked to over half of incidental deaths, demonstrating its deadly impact. Although deaths involving synthetic opioids decreased slightly, around 2.6%, in 2022 versus 2023, in Harris County, the decline in accidental drug-related deaths is likely due to increased community efforts to make naloxone more available, helping to reverse opioid overdoses. In the face of rising fatalities, harm reduction has become a vital strategy for saving lives. Harm reduction involves practical measures to minimize negative consequences of drug use by meeting people where they are. This includes programs like needle exchanges and naloxone distribution. So, harm reduction does not promote drug use, but aims to make it less lethal. As awareness grows, more people are supporting harm reduction initiatives. Jurisdictions with take-home naloxone programs and training on its administration have seen significant reductions in opioid overdose deaths. A survey of 48 of these programs in 15 states plus the District of Columbia reported over 10,000 opioid overdose reversals. So in 2015, Texas passed legislation allowing naloxone to be prescribed to at-risk individuals and those who might assist them. This law, supported by organizations like the Texas Medical Association, the Texas Pharmacy Association, and others, also permits non-medical professionals to administer naloxone via injection or nasal spray. Between 2018 and 2022, Texas's centralized naloxone program distributed over 570,000 doses of naloxone to individuals, agencies, and organizations. Educational programs and community partnerships are expanding, bringing essential harm reduction resources to those in need. Texas is increasing its harm reduction efforts by implementing policies that support naloxone distribution and pilot even needle exchange programs. For example, Pilot Syringe Services Program in Bexar County, initially approved in 2007 and launched in 2019, had about $80,000 in investment for a one-year pilot. These programs prevent bloodborne infection like HIV and Hep C by reducing non-sterile injections. Studies have found that access to sterile syringes reduces HCV and HIV transmission rates by at least 50%. So in cities such as Austin and Houston, harm reduction organizations work tirelessly to combat the fentanyl crisis. These programs have saved countless lives, and advocates continue to push for supportive state policies. The Houston Harm Reduction Alliance, or HHRA, has been serving the community since 2017, providing naloxone training, hygiene supplies, safe syringe disposal, and referrals for HIV and Hep C testing and substance use disorder treatment. Also, the Austin Harm Reduction Coalition, or AHRC, established in 1994, started with a syringe exchange and has since evolved to offer mobile harm reduction services, syringe access, safe disposal, OD reversal supplies, community referrals, and just safer injection training. They also provide linkage to recovery services and basic first aid. They focus on high-need areas in South Austin, and again, harm reduction, one-on-one, meeting people where they are, where they live, where they gather, and helping them along on their journey. So fentanyl overdose crisis demands compassion, support, and practical solutions. Harm reduction is crucial in this battle. By expanding these initiatives, we can offer hope and save lives one step at a time. Together, through community effort and supportive policies, we can make a significant impact and reduce the tragic toll of this epidemic. In addition to the community organizations we listed above, CORRE offers free education for opioid overdoses, the history of opioids, policy, and other things that you may need to help save a life. If you are interested in learning more about that, we have another video called OE&A, or Opioid Overdose Education and Naloxone Administration Training. So thank you for making it to the end of this video. In hopes for educational purposes, we have a few survey questions. It's about 2 or 3. Just trying to see if you guys like this content, if this was educational to you, and if you want more things like this. Thank you.